Hi, everyone. Welcome to our webinar on, Hi, everyone. Welcome to our webinar on the LGBTQ identity and eating disorder recovery. We are excited to offer this webinar in partnership with EDCare today and are so glad that so many of you could join us. My name is Lynn Slosky. I'm the Executive Director for ANAD, and I will just quickly, in case you're not familiar with our organization, just tell you a little bit about it. So we are the oldest organization devoted to helping people recover from eating disorders. We try to alleviate suffering and provide support to those struggling with eating disorders all around the country. And we do this with a variety of support services. All of them are absolutely free of charge. We have our helpline, our support groups around the country, including online. We also have recovery mentorship, grocery buddies training. We also offer an annual conference aimed at professionals to learn more about the field of eating disorders. And then we have our downloadable ANAD approach guides. All of this information can be found on our website at anad.org. And so I don't want to spend too much more time describing our organization because we're actually all here today to learn from Dr. Julia Sadusky. She was kind enough to put together this PowerPoint to tell us all about LGBTQ identity and eating disorder recovery. She is a postdoctoral fellow at EDCare's Eating Disorder Treatment Center in Denver, Colorado. She also currently offers trainings to increase education and improve clinical practice related to sexual and gender identity. She has worked primarily with patients navigating eating disorders, substance use, trauma, and co-occurring concerns throughout her clinical work at substance use residential treatment, outpatient mental health clinics, and university counseling centers. She completed her doctorate at Regent University in Virginia, where she focused on the study of sexual and gender identity as part of the Sexual and Gender Identity Institute there. She consulted with many individuals and families from all over the country who were navigating gender dysphoria. She also has a couple recent publications, including Approaching Gender Dysphoria and Understanding Transgender Identities. And then she's working on another one about gender identities from today's youth. So clearly a lot of background and experience with working with this population, and we're really excited that she'll be with us today. We will have time to answer a few questions at the end of our program. So Dr. Sadusky will wrap up about 10 minutes before the hour. Feel free to send us your questions at any time in the questions tool that is part of your control panel on the right side of your screen. And Kristen, ANAD's operations manager, and I will moderate those questions, and then we'll have time at the end to pose a few to Dr. Sadusky. So without further ado, we will pass it over to Dr. Sadusky to start telling us about our topic today.
Hello, everybody. Can you hear me okay? Let me go ahead and get my screen pulled up here so you can see the PowerPoint. All right, it is good to be with you all today. I'm excited to get the chance to share a little bit with you about what I've been learning about the intersection of eating disorder recovery and individuals in the LGBTQ+ population. So I want to give you a little bit of a foundation for what we'll be talking about today. We're really going to lay some groundwork on what do we know about sexual identity and gender identity, specifically talking about terms. Sometimes that can be a real barrier to understanding a lot more of the conversation around these topics. So I want to start there. I'll give you a little bit of background data on what we know about LGBTQ identity and eating disorder diagnoses and how those intersect. And then look a little bit more at the current trends in mental health care for LGBTQ plus people, and figure out what can we do in treatment around eating disorders for diverse populations. And then, of course, we'll have time for Q&A at the end. So let's dig right into some key terms. I want to start with sexuality and name that sexual identity and gender identity are related, but not synonymous topics. So when we think of sexuality broadly, we're talking about an umbrella term that captures both sexual identity, meaning how you label your sexual orientation, sexual attraction, so who am I attracted to, and then sexual behavior, what do I do sexually with others? So some people experience a range of sexual attractions and don't adopt specific identity labels related to that. So we see a little bit of distinction between people who say, yep, I've experienced sexual attraction, for instance, to both the same and opposite. Some of those people do adopt an orientation, say bisexual or any other number of terms there. And that really gets into how you label, right, sexual identity. Lisa Diamond, a researcher, has been understanding the topic of sexual fluidity, which is really the ways, more specifically for women than for men, sexual attraction can shift over time. And so we won't get into that too much, but I just want to give you a sense for some of the lay of the land there. So the labels that people use to talk about sexual preferences can be many, right? Some of you might have heard gay, straight, bi-curious, questioning, queer, asexual, pansexual. There's a whole range of labels available to people as they're trying to figure out, what do my attractions mean for me, and how do I want to talk about them and communicate them to other people? An important distinction here is between private sexual identity and public sexual identity. It's private sexual identity is when I look in the mirror, how do I identify my sexual preferences? What do I think about myself in relation to them? And then public sexual identity is more about how I'm known by others. So there are people for whom, the way they're known by others is really different than the way they think about themselves privately. This is not uncommon with young people today who are really trying to figure out their sexual identity a lot of times. And there may be some distinction with how they identify privately and how they identify publicly. But what we know is among emerging adults today, there's distinction between identity, people who adopt an identity label related to same-sex sexuality, for instance, then a larger portion of the population, about 4 to 7% in a range of studies that would report some level of attraction to the same sex, for instance. And then about 4 to 10% of the population, which is quite a range there, that's gathering quite a few studies, engage in same-sex sexual behavior. So that tells you a little bit about why we distinguish between each piece. So let's move a little bit more into the realm of gender identity here. Many of you would be familiar with the term biological sex, right? That's talking about chromosomes, genes, hormones, physical markers, and anatomical distinctions in our bodies. Gender, though, is the psychological, social, and cultural aspects of being male or female. Gender identity then describes how a person experiences themselves or thinks of themselves as male or female or something else, including how masculine or feminine a person might feel. And then gender roles are how much and the degree to which we adopt cultural expectations for what we know within the binary of that maleness or femaleness. So then I want to break down a couple of terms that more recently I think have been really brought to the forefront of our minds. So let's start with terms like cisgender and transgender. Cisgender is a term used by people who would experience a level of congruence between gender identity and biological sex, okay? So meaning cis means on the same side of, so I'm on the same side biologically as my sense of gender identity. That's a way to remember that. Transgender then is an umbrella term, so a broad term for a range of ways that people might experience or present or live out a gender identity differently from those people whose sense of gender identity is congruent with their biological or birth sex. Okay, so this includes a lot of different people. It could mean a person is transsexual, or a person has engaged in certain treatments to transition. So say a biological male who transitioned and lives as female. Things like third sex, two-spirit, cross-dressers, all of these can fall under that transgender umbrella term. And then gender dysphoria is an experience of distress related to having a psychological and emotional gender identity that does not map on to a person's biological sex. So that's what makes gender dysphoria distinct from transgender identity. Not everybody with gender dysphoria identifies as transgender, and likewise, not everybody who identifies as transgender does so because of an experience of gender dysphoria. So transsexual is actually a term that is being used less and less today, but I would say that that has historically been used to describe a person who believes they were born in quote unquote the wrong body and wishes to transition or has transitioned through the use of hormonal treatment and sex reassignment surgeries. And so when people are talking about terms with you, these are some of the other ones you might want to be familiar with. Genderqueer, another umbrella term for the ways in which people experience their gender identity outside of the binary. Sorry, it looks like those words got out of alignment there. So some people might prefer a gender neutral pronoun like one to reflect the way that they don't experience their gender within a binary, meaning male or female. And then I give you here a whole host of other terms, emerging gender identities that can help you understand what is somebody talking about when they say bigender, pangender, agender, or a person presents as androgynously, which really just means that their gender presentation is either a combination of masculine or feminine or something more neutral. So I won't read all of these to you, but I did want to give you them as a way to locate who we're talking about here. Gender bending is another thing. I think in young people today, we are seeing this quite a bit more. This is when people are intentionally crossing or pushing back on traditional or stereotypical gender roles. So that's the concept of gender bending. And then finally, there's something called an intersex condition, which is really a range of experiences where a person would be born with sex characteristics or anatomy that does not allow them to be identified clearly as male or female. So this can be related to chromosomes, gonads, and I give you an example of one there, one of the many ranges of ways intersex conditions can manifest for people. So I mentioned a few minutes ago this idea of emerging gender identities, and I think we see this today both with sexual identity and gender identity, where there are kind of a range of ways that people are describing themselves or their sexual or gender identity to others. This is where a lot of times I think culturally people end up speaking past each other, especially within different generations where there's different levels of context for those terms. And I just as a note here, when we're talking about things like genderqueer, gender fluid, transgender, these are adjectives that are used to describe persons. So I think a lot of times, not knowing how to use these terms, people might say, transgenderism or transgenders, and that doesn't really actually capture the appropriate use of that word. So I just give that as kind of a free education to people on that. Okay, so let's move a little more into eating disorders and how there's an intersection of that among LGBT people. So approximately 30 million Americans experience an eating disorder. There's a range in what we know about how that affects biological females and biological males differently, but we know about 1% to 3% of women and less than 0.5% of men, with the exception being for binge eating disorder, which affects 2% of men. For college students today, I give you there the percentages of men and women who report having an eating disorder. And in one study, it was found that 16% of transgender college students reported having an eating disorder. Okay, so interestingly, another study found that mostly heterosexual girls had higher rates of dieting and eating disordered behaviors than heterosexual counterparts. So at the same time, lesbian and bisexual girls were happier with their bodies, put less effort to look like those in the media, and did less really to try to make shifts and changes in their bodies than heterosexual counterparts. An interesting note here, though, is that gay and bisexual boys put more effort to look like those in the media and had increased binging compared with heterosexual counterparts. What seemed to be mediating that was exposure to media. So it seems like media has a powerful way, specifically in sexual minority men, in impacting how they see themselves and how they feel they ought to be physically in the world. So let's move a little bit more into the trends we're seeing for treatment today. So I want to name that, for some people coming into eating disorder treatment, your sexual identity is a diversity variable, okay? Maybe I work with somebody who identifies as lesbian, and they don't really want to talk about that in therapy. They want that to be known, that that's their sexual orientation and identity, but that's not a focus of the work. Now that would be very different for a child, say, 9 or 10 years old who experiences gender dysphoria, that level of distress around gender identity, and they're also experiencing disordered eating. The gender identity piece might actually be part of the work of therapy, helping them explore gender identity, figure out coping skills for gender dysphoria. And then when it comes to young adults today or emerging adults, here at EDCare, I work with a lot of people who are navigating sexual identity questions, gender identity questions, and trying to figure that process out. And they so benefit from having places, especially therapy, to process and try to figure out where they go with sexual and gender identity. So we want to take a developmental perspective and know developmentally where is a person at, and how might we integrate sexual and gender identity exploration in therapy when a person presents to address an eating disorder. So what are some of the trends in treatment today? I would say that one of the most prevalent things that, especially with young people, we'll work with them on in relation to eating disorder work is support through disclosures. So how does a person prepare to tell people in their life, right, to express a public identity related to what they've been experiencing privately, related to sexual orientation in particular here. Sometimes I talk with young people today about the use of descriptive language and the use of labels and thinking through how do I talk to different people in my life about what I'm going through. For instance, generationally, I already mentioned this, there's differences in what certain labels mean. And so we want to be able to help people think through strategically, how can they be honest about their experience in a way that communicates it for family and friends who might not be familiar with some of the more recent used terms. Another thing we can help people with is identifying safe people. Sometimes disclosure around sexuality and gender does not go well, and sometimes we can't predict that. But insofar as we can, part of treatment and helping people with social support who are navigating sexuality is helping them figure out who is safe in my life and how would I know they are? How do they talk about people who I think of as being like me? And then throughout that process of disclosure, monitoring self-care, if you're thinking about people who experience eating disorders, especially at the level of care I work in, can be in very compromised places physically. So we want to be monitoring how do you take care of yourself when you're sharing about your experience to people and can't always predict how they'll respond. And sometimes people respond in unpredictable ways. And then also understanding milestone events. So what I mean by this is that the research today is moving away from thinking about sexual identity development in more of a stage model and thinking of it more as these milestone events that people hit in their life. So there's distinctions between when a person might experience awareness of attraction, whether it be to the same sex, opposite sex, first engagement, and sexual behaviors. What meaning people make of that, that's that attribution piece. How people identify, how people label about their experience. And then who they share and when they share. Most often people will share with friends first, then mentors, maybe siblings within that too. And then research shows that they typically will disclose to a mom, and then lastly, a father. So interesting, to notice just the different milestones people hit, and following disclosure or preceding it in some cases is sexual relationships, romantic relationships. So these are the kinds of things to just be mindful of and be thinking through, when are people hitting these milestone events? This gives you some age ranges on that. And also, developmentally speaking, if somebody's navigating an eating disorder, how are those milestone events impacted by the presence of an eating disorder? We'll talk about that in a few minutes a little bit more. Okay. When it comes to addressing gender identity, I want to name again that we distinguish between sexual and gender identity. These are related constructs, but not synonymous, right? So sexuality is our patterns of attraction and how we exhibit and express those attractions in our world. A gender identity is my felt sense of self as male or female or something else. When it comes to addressing gender identity, specifically in the mental health field, what we're encouraged to do is help people explore gender identity without a fixed outcome for what that looks like for them, and taking seriously human development and what we know about different stages of life. Acknowledging, and this is coming directly from the American Psychological Association, that not every transgender or gender nonconforming youth will adopt a transgender or gender nonconforming identity into adulthood. So a lot of what we're doing in therapy is helping create a safe place for people to explore gender identity without us presuming that all of them will adopt a transgender identity into adulthood. What's really important here, especially with eating disorders, is a multidisciplinary team approach. When it comes to gender identity, if a person is considering interventions that we know of today, such as hormonal therapy or surgeries, really important that there's a multidisciplinary team, an endocrinologist who can speak into that and help a person make an informed decision about things like that. Another important piece of therapy is definitely affirming a range of diversity variables and the ways those can intersect with gender identity. And also the ways, eating disorder can speak into that process. And I'll talk about that in a few minutes here. And also understanding and exploring stigma, prejudice. I mentioned media earlier, the influence of media, and other things that might impacting how an eating disorder manifests for those who are adopting diverse gender identities. I'm thinking of somebody I've worked with who shared with me that they had an idea in mind about what it meant to be genderqueer. There was a specific body size that came with that, and they weren't sure whether or not they could adopt that gender identity because of the idea they had in their mind about, what is to be expected of that person's body type, if you will. So you can see how that intersects right there. So I want to give you a little bit more information just around what we know about gender identity and gender dysphoria. This is really important when we're also working with people with eating disorders, because there are several ways dysphoria, that distress around gender, can manifest, right? It can manifest socially, so discomfort with presenting socially, being known by others, in my case of biological female as biologically female. Body dysphoria, so discomfort with the body being different than how they would expect it to be. And we take our body everywhere, right? So this can be an enormous source of distress that layers in when a person also has body image distress around an eating disorder, right? And then mind, so discomfort with our mind and emotions and feeling as if those don't line up with a person's gender identity. So feeling like they experience themselves as male, although they are biologically female, say. And then I give you this image of an iceberg here because I think this is a really helpful image to appreciate. We know so little about a person who presents in a gender atypical way, say, in how they dress. A lot of young people today are exploring gender identity and engaging in what's called gender bending. You heard me say that. But you know, I might have somebody come into my office, biologically female, who has a really short haircut, dresses in a way that's more androgynous, and I don't really know from that how much that is, you know, expression of self, a way to experience a sense of congruence with your gender identity. Maybe a person is doing that to manage actual distress around gender dysphoria. For some people, it's actually for entertainment purposes. This is more of what we think of when we think of something like a drag show. There are those people who cross-dress for the sake of arousal, people who do it for the sake of self-soothing, and I've even worked with people who say, hey, it's honestly just for boredom. So I give you that to say that for people in our lives, for we ourselves, for young people navigating gender identity, what we know and what we don't know based on the presentation of a person, that whether it be somebody that you're working with, somebody you're friends with, there's a lot beneath the surface of that iceberg that's worth exploring more. So when it comes to addressing LGBT mental health, okay, broadly, because we know a lot less in the area of specifically the intersection of eating disorder recovery and LGBTQ experiences, I want to give you just a sense for the lay of the land broadly in trends for addressing LGBTQ plus mental health. So the dominant understanding today for why we see a range of increased mental health concerns in the LGBTQ plus population is something called minority stress theory. What I mean by that is that when a person is a part of a minority group, okay, they get hit with a bunch of different reactions, responses, and feedback from people in relation to that minority experience, okay? And we're talking minority in the case of numbers here. And with that, whether it's prejudice, judgment, rejecting responses, a person will be more likely to experience depression, anxiety, things that come with social isolation, for instance. And so oftentimes what happens when we get treated by others in a way that is shaming or harmful is we can internalize that about ourselves, right? You know, in eating disorder work, if somebody talks about your body in a way that is negative, humiliating, and offensive, a lot of times over time, we can start to talk about ourselves and to ourselves in that same way, right? That's internalized self-stigma. And so what we want to do in therapy is help increase a person's access to adaptive coping and support, which can be more complicated, especially when you're intersecting various diversity variables, okay? Is where do people turn to, sexual and gender minorities, to cope with the challenges that come from recovery, for instance, with an eating disorder, when there's also these other layers to that experience. In therapy, what we're doing is helping people understand better, how do I make sense of what I've been through in my life related to things like discrimination, harmful reactions from people? How do I make sense of my own felt experience of sexuality or gender? Do I hold that at arm's length? Do I have disgust for that? Or can I be curious about it and try to understand it better? And also, how do we help, especially young people today, grow in their capacity to emotionally regulate, to manage what's coming up, whether it's self-hatred, self-loathing, anger, right, sadness, and bridging the gap for people to help them be able to manage life a little bit more over time. And again, wanting to bridge access to resources, which can be really difficult here. So let me shift a little bit then to what we know about treatment with eating disorders, okay? The first thing we want to do is appreciate intersecting diversity variables. You know, when people come to therapy a lot of time to see me, one of the hardest things is that disclosure, even if they've publicly been known as LGBTQ+ in other areas of life. There is a level of power that in therapy at least is there that can make it really difficult to name aspects of your experience, especially if in the past there have been shaming responses. So I think as therapists, what we do is we try to help people level the playing field a little bit. Is how do I share about my experience of the world and trust over time that this other person will be able to hear it and make space for it. It's really, really important at the intersection of eating disorder work and LGBTQ experiences. You know, a lot of times people I work with will say, I don't know if I can talk about that here. You know, can I bring in the attractions that I've been experiencing? Can I bring in conversations about relationships? And I'm wrestling with how do I get my needs for intimacy met in life? And another interesting thing and important thing to be aware of is that a lot of times eating disorders really impact people's level of sexual desire, right? Malnourishment absolutely has an impact on how connected we can feel to sexual desire, how much people want intimacy with a partner. And a lot of the LGBT people I've worked with here will talk about just not experiencing any sexual desire. Some of them might be drawn to a term like asexual for that reason, actually. Not all, but some will wonder, do I feel sexual desire at all? It's been so long, or maybe it's been through puberty that they've experienced an eating disorder, and there's never really been a time where they've been in touch with sexual desire. And so being in treatment for an eating disorder can awaken sexual desire, sometimes for the first time since puberty. And so this brings up, right, questions of how do I get my needs met for community, intimacy, relationships, and what does that mean about things like labels, what a lot of people are wrestling with. Of course, you know, questions around sexuality and gender are also complicated when a person has experienced traumatic things. So I, you know, run the trauma track here, and we talk a lot about how even having sexual desire, sexual arousal can feel threatening if people have experienced trauma where sexual arousal is tied in their mind to disgust or tied to being at risk for manipulation in some way. So some of the work with eating disorders, right, is as a person's nourishing and attending to their basic needs in their body, specifically their nutritional ones. You know, what are the memories that come up related to trauma, and how does that complicate for those who are exploring sexual identity or gender identity, for instance, many of the young people that I work with today, or people even older in age, you know, say, you know, a person who's married and they're trying to figure out, wow, I haven't had sexual desire for my partner in years. Well, what does that mean? And then ultimately appreciating that hierarchy of needs to attend to. So obviously, you know, I work at a partial hospitalization unit, and it's really important to prioritize for people kind of core nutrition. And so for the young people that I work with who are also wanting to explore identity, maybe feeling desire sexually for the first time, and they're trying to make sense of that, a lot of times we really are slowing someone down and saying, listen, we'll get there. But that exploration too can also be dysregulating at times. And so wanting to make sure that people have skills to navigate things like disclosure, if they're developmentally in that place, but really attending to the core nutritional needs, the psychological needs at that time, matters of safety, prior to moving into trauma work, certainly and some of these other exploratory identity-focused approaches, we want to take a gradual view with people and a long-term view to appreciate that not all of this will be understood immediately, which for some people can be frustrating. So more things to build on here is thinking through, in addition to the timing of identity exploration, if and when this is actually indicated, right? I mentioned earlier that some people come and they're, 40 years old and they're in a relationship and they're not looking to explore identity as much as, this is a diversity variable, something to hold in mind, something to talk about, but not the focus of work. I think another thing that often comes up, specifically when working around eating disorders, is thinking through, disclosure. As people are in treatment for eating disorders, I already mentioned that sexual attractions can reemerge, right, that haven't been there for a while. So a lot of people can say, on one hand, I'm not going to talk about this with anybody in my life until I know for sure. And that's one way of doing it. Others say, I'm not going to share about my sexuality or my gender. I'm just going to let people find out over time. I'm going to show up at, family dinner and present in such a way that communicates to them my gender identity without having to tell them. And I can appreciate that, and also want to help people understand the distinction between disclosure and discovery. That actually there's an empowerment that comes from disclosure that may not always come from being in a more passive stance with people. A lot of the people who experience eating disorders do end up taking a more passive stance towards life, where it can feel like my needs are not that important. What I'm experiencing, I don't want to take up space, so I don't want to talk about that with other people. And all of those can be barriers to being known, which is part of why we share about anything that we're going through in life, even if we're not sure where it will take us. Something that's really evident both in eating disorder work and then work with LGBTQ people is taking family-based approaches when possible. One of the things we know about sexual and gender minorities today is that young people who identify as LGBTQ+, the best predictor of their well-being over time is actually the quality of the parent-child relationship, meaning their relationship with their parent or parents. So as many young people today say, I don't need my parents, I'm good, I'm not worried about them, I'll catch them up later. I'm always trying to help people appreciate that, both for addressing eating disorders and for navigating things like sexuality and gender. It is important, if possible, to bring in family. And if people don't have families that feel safe or feel, especially in cases where families are abusive or dangerous to somebody's well-being, oftentimes we talk about who is your family of choice. Who are the people in your life who can really rally and really support you as you navigate what you're going through with the eating disorder, who can offer accountability to you in your life, and also with some of these other questions that people may be asking. And one of the other important things is getting to know more of the body image piece. This is a huge component of many eating disorders, is the experience of one's body, right? And media does not help us with this, right? Media makes it really complicated for us to have a honest and realistic idea of what the body is and how it moves and lives in the world. So I want to move a little bit more directly into body image, okay? So when it comes to body image, what we're talking about here is how I perceive myself when I picture myself in my mind, or how I see myself when I look in the mirror. Okay, so what do I actually see? This includes not only how I feel about my body, but also how a person feels about height, weight, and shape. All of these things together impact our sense of body image. And there's layers here when it comes to work with sexual minorities and especially gender minorities, okay? So if we're talking about broadly the transgender community, we're talking about young people who identify as genderqueer, gender non-binary, people who experience gender dysphoria, certainly, there can be some added layers to body image concerns. And a lot of the people I've worked with say, I've really never thought about that before, but that's what makes recovery so threatening for me, is I already feel discomfort in my body. Say a person who experiences that distress of gender dysphoria, how can I even imagine pursuing recovery when I don't know what that will mean about how I feel in my body? In fact, a lot of the research is showing us that disordered eating and that drive to thinness that we see in some eating disorders is actually in part to suppress features of some people's biological sex. There can be, a range of reasons for that. Trauma certainly has an impact on this. I've worked with people who say, after that traumatic experience, I've really committed to not having the anatomy that I had when I experienced those things. And for other people, there's gender dysphoria about features of their anatomy. And so that's part of the complications of their own disordered eating. So oftentimes, right, for transgender individuals, that body image distress related to gender is often primary. So that gender identity piece is really important to attend to, that when a person's talking about body image concerns, who might identify as transgender, for instance, some of that, and probably a larger portion of that, comes as a result of the gender-related distress than even the eating disorder driving some of that conversation. So it can help us appreciate quite a bit more, right? The complications, the things that we want to be considering in supporting one another who are experiencing eating disorders, and not oversimplifying this experience. I've worked with somebody recently who was just sharing that, they sit in a group and talking about body image, right? And a lot of people in an eating disorder clinic get the whole, I don't like who I am. I don't like who I see, right, when I look in the mirror. But for those navigating, in the case that I'm talking about, gender identity, there's this added layer that can often lead to greater isolation in a space, because they're saying, yeah, but I don't think you know what it's like for me, and I'm not sure how to communicate that with you. So part of the work of therapy, right, is really helping figure out what is that? What is beneath that broader understanding of distress around my body? And what are the factors that impact that for me? This is important, in dietary work, it's important in therapy, it's important in psychiatric care with the LGBTQ population, to appreciate that influences like media have a really powerful say in what we describe and come to know as normal, right? And so we want to help people with that in the work that I do, certainly, but also be thinking in your own life, how is my body image impacted by stereotypical notions, for instance, of what it means to be a gendered person, and how much of that is impacted by the culture and media portrayals, even within the LGBTQ population. As I mentioned earlier, a lot of people feeling like, I don't think I can be adopting X or Y, label, because I don't fit what I think of or what I've seen in media about what it means to live in the world in that way. And that goes for those who do eventually, say a teenager, biologically female, who ends up not adopting a transgender identity, and for a person who does, is sometimes feeling like, am I allowed to be in the body that I have, and how would I know? And those are some complications there. And here's where the rubber meets the road, right? Is that our body image and our mental health and our self-esteem are so interwoven for all of us. They impact one another. How I feel about what I see when I look in the mirror, how comfortable I am with the way I look, how in tune I am with what my body needs. All of that will impact my mental health, whether or not I do take time to care for myself, even when I'm dealing with difficulties, whether I tend to meeting my basic nutritional needs. I mean, do I feel like I'm deserving of that? That's a common question people will ask. You know, can I handle disappointments and difficulties and know they're not a reflection of my worth? Or do I find that based on what number I see on a scale, something as arbitrary as that, or the quality of my romantic relationships today, or how resolved I feel in certain labels that I'm drawn to? How much do I feel that those things reflect my worth? And can we normalize brokenness? This is another important piece of how mentally well we feel. It's one thing to feel unwell mentally. It's another thing to make judgments about that, right? One of the important pieces of resilience in mental health is knowing that I will not be 100% perfect all the time. I will not be 100% okay all the time. And that's okay. Because ultimately, we want to help people move to a place where our sense of self, self-esteem, self-worth is rooted in our capacity to be effective in our world. That means placing realistic expectations on myself and on other people. I'm feeling confident in who I am. That doesn't hinge on something arbitrary, like body size, for instance. And can I respect myself for my strengths and my weakness and hold both and have self-compassion for the things that I'm struggling with? So you can see how interwoven each of these pieces are. A negative body image flows into our mental health. It flows into our self-worth, which flows in back to the weight that we give our sense of our body. And so all of these things are certainly impacted by certain diversity variables, like LGBTQ plus identity. They're absolutely impacted by our access to sources of support, which can be more complicated for members of the LGBTQ population. And it's absolutely impacted by our experience of an eating disorder and how that plays into things like intimacy, bridging gaps for community, and the like. So I want to stop there and open up some time for Q&A. I would love to hear kind of people's thoughts, feedback, questions, and see how I can help in some way.
Definitely. Thank you so much, Dr. Sadetsky. This is Lynn now also talking, and we've been monitoring the questions throughout. So Dr. Sadetsky, I'll start out with a question we have from Christina, kind of adding in another layer to this piece of LGBTQ plus identity, which is the racial identity issue. And specifically, she asks, how can we think about the ways in which marginalized racial identity, in addition to a marginalized sexual orientation or gender identity, impacts treatment, symptom presentation, and our responsibility as providers?
Yes, what a great question. Yes, I mean, there are so many diversity variables that intersect here for any different people, right? So I'm thinking about, you know, a young African-American female I worked with who experienced disordered eating, was a member of a Black church that was home for her. That was her family, that was her community, and also a church community that really did not feel equipped to support her in navigating sexual identity, okay? So she turned to her eating disorder, right, to cope with the isolation she felt, the ways she felt misunderstood. But she also didn't feel the luxury to just leave this community. I mean, these were her family. These were the people who made up her strongest source of support. So whereas in some approaches to treatment, people might say, okay, go find a new faith community or leave that behind altogether, right? For this person, you know, she was really feeling like, no, these are my people And I would rather be in community with my people and feel isolated and turn to my eating disorder than leave behind this community without really feeling any sense of promise of finding a new community. So I think this gives us pause as professionals in how we can almost trivialize our problem solving with people and say, well, you just do this, you just do this. And we really have to appreciate the way ethnic identity in particular complicates and can also be a resource to people, right? I think with minority stress theory, one of the challenges is we don't always appreciate the strengths that come from a range of cultures. I have another patient right now who is an Asian American, and certainly as they're trying to differentiate from the eating disorder self and also from their family of origin, there are complications with that, right? And a sense of loyalty to their family that makes it really, really difficult to differentiate and makes them return to the eating disorder in ways that are really destructive at times to maintain a sense of peace and harmony in the home, which is a value there. So I think, we take on a posture of cultural humility there and come in as a learner without making the other person do the work of always teaching us. So there's a balance there, right? Is empowering somebody to share about their experience and be an expert on their experience of identity, the cultural factors that play in there. But ultimately doing our work too, our homework to be able to walk alongside them and continuing to prioritize doing research at the intersection of various identities. You'll notice there's not a lot in this content about that. There's not, sadly, a lot of research out there yet. And we really do need to prioritize that because there are important distinctions based on things like ethnicity, LGBTQ identity, and the like.
Well said. Okay, we have another question about internalized homophobia and how that can also affect disordered eating and eating disorders.
Yeah. Yeah, so I mean, nowadays it really is captured in that term internalized self-stigma. So if you heard me talk about that, really we're talking about, that's a broader term to capture internalized homophobia, certainly, and internalized transphobia, which again is that process of really, because of the way we're treated and responded to by others, internalizing that our sense of self is bad, disgusting, unworthy of care, unworthy of love. I'll share with you, there have been people I've worked with who are the biggest advocates of defending the dignity of other people in their life, right? Can be really fired up if they hear somebody talk in a condescending way about the person next to them in a group who may be a member of the LGBTQ community. And yet when we're sitting together in sessions, can have absolute disgust for their felt sense of gender identity. We just want to lock it away in a closet. Part of the work we do, right, is noticing that and honoring, where did that come in? Where are those messages really coming from? Where have you heard that? Certainly it's coming from within currently, but nobody comes out of the womb that way, talking about themselves that way. So wanting to appreciate that. One question I'll ask people is, how do you think about people who are navigating gender identity, people who are navigating sexual identity? How do you think about them? And then how do you think about yourself in you navigating this space? Those are very often different answers, right? And the latter answer comes in with a lot of messaging that can be really, really harmful. It leads to a great feeling of shame. Shame is the idea that I am bad. Okay, guilt is I did this thing that's bad. Shame is I at my core am bad. And oftentimes, if I feel that I am bad, I'm going to hold other people at arm's length because I don't want them to reject me. Meanwhile, I end up rejecting myself. I see that so often when I'm understanding and uncovering that internalized self-stigma, is how do we reduce shame? How do we create a safe space where a person can verbalize some of those self-statements that are so tormenting over time? And how can we get enough space from them to critically evaluate them? That's all important to the work of uncovering that and ultimately discovering a life beyond that.
Great. Yeah, okay, we also have a couple questions about setting weight goals and nutritional restoration when there is a gender identity issue. So how does one navigate so-called healthy weight goals when someone is dealing with a gender identity situation, and then helping someone with body acceptance about their weight when they're dealing with a gender identity challenge?
Right. Well, I hope you can see and feel that complexity there, right? How complex this is, how challenging it is to do that. I think any time, within an appreciation of health at every size, which is, really moving away strongly from the idea that our body is the criteria for self-acceptance. And so anytime we make weight a goal, right, whatever that means, we can really struggle to find the line between that and colluding with an eating disorder and feeding into the idea that our sense of self, our value and worth is rooted in body size, shape, or weight. Now, that doesn't mean that we don't help people, right, get to a range of health where their body is getting its nutritional needs met so that it can find a place to land there, where it's functioning and the person is then able to thrive out of that. So it doesn't mean that people aren't working with a dietitian to meet their nutritional needs. It's just that we're not basing body size, shape, or weight as the primary focus for that person of how they know they're okay in the world. In the same way, a lot of times people are looking at other interventions, right? I mentioned earlier, a lot of the body image distress can be related to gender. And there are interventions that people are drawn to around hormonal treatments and various surgeries for that. However, even if people take those steps, there's a timeline for that, right? You might be in a position to walk alongside somebody through that process. You might not be. You might be attending to the eating disorder. And then it's adaptive coping. How do I cope in the body that I find myself in and trust in my effectiveness to do that? Now, coping does not take away all of our pain. It really doesn't. I mean, that's why we use maladaptive coping, because it sometimes works even more quickly, right, to manage pain. But the question is, how can I see myself as effective in managing and living in the body that I find myself in today, and root my sense of identity in something broader than that felt experience in the moment while I'm bridging the gap to other resourcing.
Yeah, that sounds great. Dr. Sadusky, we have 2 more minutes, and so we'll ask one more question about your work at EDCare and how you work with the other staff, and what are some of the things that make your program unique when it comes to treating LGBTQ plus patients. Yeah. And then we'll close with this question.
Sure. Well, I can't speak to what other places are doing, but I do think the work that we're doing here is unique for a couple of reasons. One of the institutional pieces of attending to incorporating, understanding of a range of diversity variables is having a diversity committee that meets to be able to attend to various diversity variables in a way that's educated and thoughtful and makes our environment here safe for people. So some of that comes in when we're thinking through options for things like where can a person go to the bathroom, right? And providing a space that is a place for a person navigating gender identity to go. That's a private restroom. We have that available to people. The diversity committee thinks through things like housing. We have a house here, and we're trying to make decisions, around gender identity and the intersection of that with, where do you live and how do you feel safe in your living situation and in the house that we have for certain patients who are here in our partial hospitalization program. I would say, though, that one of the most unique things that is available here is twofold. The staffing that we do every Tuesday for several hours, actually, we just bring the stories of our patients and really think critically about what do we know about various aspects of identity that can help us be more equipped to serve this person. So taking a really individualized approach, and then a peer supervision time on Fridays for an hour where we purely come together and put our heads together for how to improve in how we're serving, especially the individuals who might be falling beneath the cracks, identifying some of the barriers for them to engage in recovery here. And some of that certainly has to do with aspects of identity that we're talking about today. And how do we bridge that gap for people? And then ultimately, a big part of our program is family therapy. It's gently a requirement here, and that helps us bridge gaps to not only family of origin, but also family of choice. If the family of origin is not ready to support the eating disorder, other aspects of exploration people are doing here, we really bring in that support piece because that's huge for every person who's pursuing meaningful recovery, but especially at the intersection of sexual and gender identity.
Well, Dr. Sadusky, thank you for all of this great perspective, education, knowledge, and insight on this very important topic, and really appreciate everyone's interest in attending. A special thank you to EDCare for partnering with ANAD on providing this webinar, and everyone who's attended will receive a follow-up email with an evaluation, and if you are seeking a CE certificate, you will receive that once you complete the evaluation. So you do have to complete it in order to get the certificate. And with that, we will sign off. And both myself and Dr. Sadusky, thank you so much for being with us today, and we'll look forward to the next webinar that ANAD offers. Have a good afternoon, everyone.